long time no see. This is YouTube Medical University. As a doctor, I haven't had a full medical checkup. However, there is one screening I always undergo. You've probably been told that you should get a full medical checkup. My friend Mr. XX was able to detect cancer early. You see celebrities on TV who happen to have their cancer found and were saved, so you might wonder if you should get checked too, but let me get straight to the point. Neither I nor most of the doctors around me have taken it. We don't even think about taking it. People think the more tests you have, the safer you are. This is half true and half false. You keep taking unnecessary tests for no real reason, then they find a spot that would have been fine to leave alone. You're told it might be cancer, and then you can't sleep at night. You have to take more tests, which costs money and takes a toll on your body. Your money, time, and peace of mind are worn down. I see a lot of patients like that. On the other hand, if you don't take the tests you might miss a cancer that could have been prevented. There's some telling data. In our neighboring country, South Korea, a certain screening test spread rapidly. As a result, the number of diagnoses increased about 15 times in less than 20 years. However, the number of people dying from that cancer hardly decreased. In other words, there's a possibility that many cancers that didn't need to be found were dug up. Hello, this is YouTube Medical University. Let's learn together today as well, so we can be healthier starting tomorrow. However, the tests you should undergo will vary depending on your age, gender, your medical history, and your family's medical history. So you might be wondering, what exactly should I get tested for? So, by watching this video until the end, you'll clearly understand which tests you should take, as well as the differences between general cancer screenings and comprehensive medical checkups. Please be sure to watch until the end. In the latter half of the video, I'll also introduce some convenient ways to search for this information that I personally use and recommend to my patients in the clinic, so please look forward to it. Now for the first topic, let me explain why I don't undergo comprehensive medical checkups. When you hear the term comprehensive medical checkup, what comes to mind? A full body CT scan, a brain MRI, and a PET scan that examines your entire body at once. These kinds of tests are collectively referred to as a comprehensive medical checkup. Let's start with the PET scan. It scans your whole body, and areas that might have cancer light up. Cancer cells consume a lot of energy. That's why they absorb much more glucose, which is the fuel for that energy, than normal cells. When we inject glucose that's been marked with a tracer, the areas that are absorbing a lot of glucose light up. It's a very innovative method. However, it has several weaknesses. The first is radiation exposure. This accumulates every time you undergo the test. And the second is that even if something lights up, it doesn't necessarily mean it's cancer. In other words, there are cases where it lights up even though it's not cancer. You get worried, undergo further testing, and it turns out to be nothing. This is called a false positive, where the test incorrectly shows a positive result. And the third is the cost. If you pay out of pocket, it costs about 100,000 yen per test, and the fourth is scientific evidence. There is currently no evidence that healthy people who undergo this PET scan end up living longer. No difference has been observed between those who took the test and those who didn't. Therefore, I do not recommend PT scans for people who have no symptoms. Of course, if another test shows a shadow or if there are abnormalities in a blood test, that's a different story. Please don't misunderstand that point. Next, let's talk about brain screening. An MRI of the brain is a test to find bulges in blood vessels called aneurysms. Let me tell you about a patient I saw in my clinic, a woman in her 60s. She was encouraged by a friend to get a brain checkup. As a result, a small brain aneurysm, just a few millimeters in size, was found. It wasn't something that needed immediate surgery. Even so, from that day on, she became so anxious that she couldn't sleep. She kept thinking every day, what if it bursts? She said that she actually felt much healthier before getting the checkup. It's said that in brain checkups, about 2 to 6% of people are found to have unruptured aneurysms. In other words, aneurysms are discovered. Most of them are small aneurysms less than 10 millimeters in diameter. In other words, less than 1 centimeter. In those cases, most of the time, surgery is not performed and the condition is just monitored. And the probability of rupture depends on the size, but it's about 1% per year. Still, if you're told you have an aneurysm, you would feel anxious, wouldn't you? Therefore, in fact, the guidelines for brain checkups also strongly encourage paying close attention to the psychological burden and mental stress on patients when informing them of such test results. However, if you have a family member who has had a subarachnoid hemorrhage or a cerebral aneurysm, that's a different story, and it's also different for people who are at high risk or have symptoms. Therefore, I think the wise choice is to decide whether or not to undergo a brain checkup while consulting with your primary doctor. I think you might have been curious about this, but let's go back to the story about Korea from the opening. The test that suddenly became widespread in Korea was for thyroid cancer. The thyroid is an organ about the size of a butterfly located at the Adam's apple, so screening for cancer is easy with an ultrasound. So in Korea, they actively used ultrasound to detect thyroid cancer. In 2011, the number of diagnoses jumped to 15 times what it was about 20 years earlier. However, the number of people dying from it hardly changed. It would have been better not to find it. They ended up detecting even slow-growing cancers. This is called overdiagnosis. Getting more and more health checkups like this isn't always better. Sometimes getting them can actually make you more anxious or increase your financial burden, so I hope you'll be careful and selective when choosing them. Now, in the second period, I'll introduce the tests that I actually still undergo myself. I'll introduce 5 screenings that I always tell my patients to get and that I personally undergo every time. These are the cancer screenings that are population-based cancer screenings. These are the 5 cancer screenings officially endorsed by the government. The government even provides funding to encourage all citizens to undergo them. These screenings are supported by scientific evidence and data showing that increasing participation lowers cancer deaths. Screenings with this backing are usually chosen. However, as I'll mention later on, these 5 cancer screenings are by no means perfect, so please be sure to listen to that section as well. A comprehensive medical checkup costs from several tens of thousands to over 100,000 yen. However, if you use municipal subsidies, you can receive these 5 cancer screenings for just a few hundred to a few thousand yen. First, stomach cancer screening, once every 2 years starting at age 50. You can choose either a barium test or an endoscopy. My recommendation is the endoscopy because it is more accurate at detecting cancer. Helicobacter pylori is a key factor in stomach cancer prevention, right? If the examination suggests the presence of Helicobacter pylori, we can follow up with a blood test or other tests to confirm it, and then proceed with eradication treatment. According to one study, people who had Helicobacter pylori eradicated had their risk of developing stomach cancer reduced to about 1/3. Moreover, it is said that the younger you are, the greater the benefits of eradication, so please consider it. Nowadays, there are more hospitals that use very thin gastroscopes, about as thin as a chopstick, inserted through the mouth, or that perform the procedure while you are asleep. Next is the colon. Colorectal cancer screening is done with a fecal occult blood test. This test checks if there is any blood in your stool that is not visible to the naked eye. This test is really excellent, and I want everyone to take it. It doesn't harm your body, and there's no pain. Plus, it's quite inexpensive, costing around 500 yen. Moreover, when you look at studies from around the world, it's been reported that this test is associated with about a 16% reduction in deaths from colorectal cancer. Once you turn 40, I really hope you'll make it a point to get tested every year. If blood is detected in the fecal occult blood test, there's a possibility of colorectal cancer or polyps, so the next step is to examine the colon in detail with a colonoscopy. The third and fourth are breast cancer screening and cervical cancer screening. Breast cancer screening is done once every 2 years, starting at age 40. It involves taking an X-ray of the breasts called a mammogram. Cervical cancer screening is done once every 2 years, starting at age 20, so even younger people can get it. By the way, most cases of cervical cancer are caused by a virus called HPV. And this virus can be prevented with a vaccine. To get the vaccine through the National Routine Immunization Program, you must get it before finishing high school. For more info, check the description box below. Lastly, lung cancer screening. Many local governments conduct chest x-rays, but let me be honest about this. With just an x-ray, early stage cancer often cannot be detected. Especially for those who have been smoking for a long time, the global recommendation is low-dose CT scans. CT scans do involve radiation exposure, but low-dose CT uses only a small amount of radiation, about the same as a barium test for the stomach, and can detect lung cancer. A large-scale study in the United States reported that among heavy smokers, undergoing low-dose CT scans reduced the number of deaths from lung cancer by about 20%. At Japan's National Cancer Center, low-dose CT is also recommended for heavy smokers, but currently there is no government or municipal subsidy for it. Therefore, if you are concerned about lung cancer or have smoked heavily, I recommend discussing with your primary doctor whether a chest x-ray is sufficient or if you should also undergo a CT scan. Now I've introduced 5 things. In the end, when should I get each of these tests? If I had to choose just one, which should I prioritize? There are quite a lot of people who worry about these questions. In this case, when you're looking things up on your own, I often recommend using AI, even in outpatient settings these days. When you hear AI, it might sound complicated, but just give it a try and see how it actually works. For example, there's something called GenSpark. There's an AI app that has a variety of functions all in one. If you find it difficult to use different AIs, it's convenient to just have this one installed. For example, let's start by looking up cancer screenings in your city or town. Please ask GenSpark like this. Tell me about cancer screenings in Hakodate City, and please summarize the prices, costs, and how to apply in a table. It's okay if you stumble over your words like this. Voice input is convenient. Then, the AI will search the internet and look up various things for you. And here are the search results. What do you think? From a doctor's perspective, the information is well summarized. The eligible age range, the cost, and how to apply are all clearly written, so instead of typing and searching for everything yourself, you can just use voice input to ask and have it looked up for you. You can instantly see which screenings you're eligible for this year at your age and how much they cost. Next, there's an even more convenient feature. Let's also organize the benefits and drawbacks of the tests we discussed in the first and second periods. For example, like this. Please summarize the advantages and disadvantages of the cancer screening we just discussed. Please put together our family screening checklist on a single sheet. My husband smokes. I don't smoke and I've never been sick. You can also make something like this, like a family screening checklist for your household. When you search further at that time, if you share as much of your personal information as you can and add any details you know, the AI will take that into account and make suggestions that are more tailored to you. Here is the AI slide that was created with this. What I just used is a feature called AI Slide in GenSpark. As you talk it through, it organizes the key points into presentation materials. If you're not good at reading long text, summarizing them into slides like this makes them easier to view and organize. And if you save them for when you need them, you can review them right away. And there's something called a skill. The text you entered this time, which is called a prompt, can be saved as a skill. So next year, when it's time for your checkup again, you can search for it in the same way. And finally, this is the feature that surprised me the most recently. I'd like to introduce it. One of the main risks of using AI is whether the information it provides is accurate. That's an important issue. Now that we live in an online society, there is a lot of incorrect health information on social media and the internet. There are claims like this food can cure cancer, or that screening is useless, and both accurate and dangerous information are mixed together and appear the same on the internet. That's where I asked GenSpark. For example, I found this information online. Is it true that eating seaweed can cure cancer? What do the National Cancer Center and Ministry of Health, Labor, and Welfare say about this? Please research and summarize. Just by asking questions like this, GenSpark will check whether this information is true or false for you. And what helps us as experts is that this AI shows us which pages it looked at to provide this information. It even provides the links to the pages, so you can be reassured that the information is being pulled from reliable sources. Here are the actual results. Eating wakame does not cure cancer. There is no scientific evidence. Excessive intake may even pose risks. That's what it is. I tried this AI myself. I already knew that eating wakame doesn't cure cancer, and I also knew that excessive intake can have negative effects on the thyroid. I was wondering if the AI would answer that thoroughly, and it gave me a direct answer. It said there's no evidence that wakame is effective in preventing cancer. When asked if it's safe to eat wakame every day, it clearly states that excessive intake may increase the risk of thyroid cancer. It also includes statements from the Ministry of Health, Labor, and Welfare and the National Cancer Center. And it also provides more information than what you might want to know, which surprised me. It says that the content of your diet does not cause cancer to progress or affect the course of treatment. On the contrary, especially regarding cancer, there is currently no single food or nutrient that is known to definitely prevent it. It brings up pages that are written like this. I was really impressed by that. The feature I just used is called fact checking in GenSpark, and it's a function for checking evidence. I really encourage all of you, whenever you wonder if some information is true, to try asking this fact-checking feature and see what it finds. However, there are some important points to keep in mind, so let me explain those as well. AI can also make mistakes. Sometimes it tells convincing lies, and this is called hallucination, so don't take everything at face value. Make it a habit to always check the sources. In other words, see which page the information is coming from. And for the final decision, I recommend that you make the final decision yourself, and when it comes to health information, talk with your primary doctor. AI is not a tool for making diagnoses. It's a tool for researching, organizing, and preparing to consult with an expert. As long as you use it this way, I believe there's no more powerful ally. So I actually explain in outpatient clinics that there are functions like this, and this time I introduced the features of GenSpark. It's an all-in-one AI workspace where multiple top-class AIs are integrated into one. Writing documents, creating tables, organizing materials, and verifying information, functions that used to require switching between different apps, can now all be done on a single screen. The cutting-edge AIs running inside include GPT, Claude, and Gemini. That might have sounded a bit complicated, but it's like having a secretary who knows everything, someone you can ask to create documents for you, for example. You can ask it to make a table, or to summarize the key points into 3 main ideas. Just talk to it about anything you need. For now, just open the app, press this microphone button, and start talking. I think just doing that will completely change your world. In the second session, I introduced the 5 types of government-approved cancer screenings. However, there is something important to note here. There is actually still no solid data or scientific evidence that people who have undergone these 5 cancer screenings definitely live longer than those who haven't. Even so, there is data showing that the mortality rate from those specific cancers has decreased. However, when it comes to overall mortality, that is, whether people are actually living longer, there is still little evidence to support that. There was a study published in 2023. They investigated whether people who underwent screenings for colorectal cancer, breast cancer, prostate cancer, and lung cancer actually lived longer overall compared to those who did not undergo these screenings. And as a result, the only screening that clearly showed an increase in lifespan was the endoscopic examination of the colon, specifically the endoscopic examination of the sigmoid colon. In other words, neither mammography nor PSA, the main marker for the prostate, were able to extend lifespan. However, this study also has its limitations. Most of the colon study data comes from Western participants. Japanese people have different constitutions and tend to develop different types of cancer. And what they were looking at was not the reduction in mortality from a specific type of cancer, but the overall mortality rate. So for example, even if the number of deaths from lung cancer decreased, when looking at the overall numbers, that effect might have been diluted and it might not have resulted in a scientifically significant difference. So this is the conclusion I want to share. Even if you undergo the 5 tests recommended by the government, it doesn't necessarily mean you can be completely at ease. Each test still has its own advantages and disadvantages. You need to understand both sides and make your choice after being convinced. And it's important to take into account your own illnesses or symptoms, whether your family has a history of cancer, and to make decisions together with your primary doctor and others. And you can rely on AI to make those consultations more meaningful. It's easy to get nervous in the examination room. There's not much time either. It's common to hear that people get nervous and forget what they wanted to ask. So preparing in advance before the consultation is efficient. Let's try asking GenSpark for help here. I'm unsure whether to undergo a head MRI as part of my medical checkup. Please summarize the things I should confirm with the doctor and a list of questions into 5 easy to understand points. It's like this. Then the AI will think about what you should check when getting a head MRI during a medical checkup. It will research and summarize various things you should ask about. Here are the actual results. It came out in only a few dozen seconds. For example, the questions look like this. Do I need to get it now? This isn't about whether people in general should get it, but whether I specifically should. That's a very important question. And is it just the MRI? Should I also get an MRA, which is an angiography? That's important too. There's also the option of whether or not to use contrast for a head MRI. And if something abnormal is found, what happens then? That's important too, isn't it? It's not just about taking the test. If results are abnormal, you need to know what happens next. Without that, you can't decide whether to take the test. These are important questions. Lastly, if you skip the test now, when should you get checked next and what symptoms should you watch for? That's important too, right? Basically, if you don't have any symptoms, a brain checkup isn't recommended for everyone, but it's different if you do have symptoms. So what kind of symptoms mean you should get checked? That's an important question too. Many of these questions are actually recommended as important items in the guidelines for patients when they see a doctor. If you enter the exam room with organized questions, your consultation will be more efficient and meaningful, helping you make an informed decision about the tests. So with that said, instead of letting AI make the diagnosis, it's about improving your consultation with the doctor. I think this GenSpark can be very useful as your personal assistant for that purpose. Now let's summarize what we've covered so far. First, more tests aren't always better. PET scans and brain checkups have the pitfall of overdiagnosis. Second, even so, the 5 government-approved cancer screenings are highly worthwhile: stomach, colon, breast, cervical, and lung. Third, even with those 5, nothing is absolute. Understand the benefits and drawbacks, consult with your doctor, and make your choice. And then, research, organize, and prepare for your consultation with GenSpark, the tool I introduced today. This time, I was approached by GenSpark, and since I use it regularly myself, I decided to introduce it to you. Let me also mention the pricing. Nowadays, it's common for people to subscribe to various AIs individually, like GPT, Claude, and Gemini. Grok! If you subscribe to all of these AIs with the premium plans, it costs about 12,000 yen per month. But if you use the Plus plan of GenSpark, which lets you use all of them together, it's about 3,800 yen per month. I think it's worth trying it out, so you won't be overwhelmed by health information. If you can't use your smartphone well, or even if you search, you don't know which one to choose. For people like that, now that AI has evolved, we've entered an era where you can just talk and get advice. Please check the description and the top comment for how to register. And one more thing, after listening to today's talk, please tell me just one test that you thought you might want to try or one you thought you might want to skip. Saying it out loud helps you remember and change your actions, so I look forward to your comments. I've summarized today's materials into a single A4 sheet. You can easily view the 5 recommended cancer screenings and what to check before each one. If you stick it on your refrigerator or somewhere similar, when you get a screening notice, you can quickly compare and choose which ones to take. Register with the official line via the link in the description and enter cancer screening. We'll give it to you for free right away. And if today's video was even a little helpful, hitting the like button and subscribing to the channel really encourages me. At YouTube Medical University, we'll keep sharing simple, helpful info from a doctor's perspective. See you again in the next video. I have just one announcement for those of you who watched until the end. I've created a place where I can share health information more deeply and interactively. It's called Kokokura, your go-to consultation room for mind and body. Many people tell me they're concerned about their health, but don't know what to believe. At this consultation room, I receive many questions, from how to read your screening results and how to deal with medications, to caring for your family members, and I personally answer each one 24 hours a day. If you're interested, please register for the free official line account first. Every month I send out sample videos of member content so you can experience what it's like. Openings are announced first to those registered online. Please check the link at the very top of the description for registration. I'm looking forward to seeing you there.